What if I told you that you could look 10 years younger in less than 1 hour without going under the knife? Well, there is a groundbreaking procedure that will turn back time called Ultherapy, which lifts and tightens the skin. Here to discuss the procedure is Dr. Matthew White, assistant professor from NYU Langone Medical Center. Dr. White, thanks so much for being here today.
Tanya, thank you so much for having me this morning.
You were instrumental in developing this procedure, is that right?
That's correct.
Tell us a little bit. You conducted the first clinical trials?
Well, I performed, this was my research thesis. I did my surgical training at Harvard, and most of the development of this device was done at the Mass General Hospital and the Mass Pioneer Infirmary. And I was very fortunate to work with a talented team of engineers and clinicians, and we're very excited to see this device come to fruition.
All right, so tell us how Ultherapy works exactly.
So I'm very excited about this new technology. So this is the first device of its kind to actually get FDA approval for lifting of the facial tissues. And you're familiar with ultrasound. Ultrasound's been around for decades to actually image the mother's womb, and Ultherapy is based on the same technology. We're actually able to see before we treat the patient. So first we perform ultrasound imaging to see beneath the skin. We plan and target our treatment, and then the device is able to deliver ultrasound energy beneath the skin without harming the outer surface, so there's no downtime. And that ultrasound energy is actually able to stimulate the rebuilding and the renewal of brand new collagen. And this is what actually lifts and tightens the face. So we really rejuvenate the face from the inside out.
Fantastic. And how long does it take to see the results? I mean, are they immediate?
That's really an interesting question, because what I like to do with my patients is we perform a full face and neck treatment, and then we pause right afterwards, and we do what I like to call a halftime analysis. So we go look in the mirror, and patients are actually able to see a result immediately. And that result just keeps on getting better. So a gradual process over a 3-month period, the skin continues to rejuvenate, and that gives you a gradual lifting of the face and neck tissues.
So this is a one-time procedure. You don't need to go back for repeat visits.
Most of my patients only need one treatment. That's sort of personalized with the individual patient. But we're looking into down the line in the future, because with each therapy we actually build new collagen. So it might be possible after a year or two to go back and do a booster treatment to really stimulate the rejuvenation of the face.
So who is the ideal candidate for this procedure?
So the ideal candidate has mild to moderate sagging of the face, and really the patients that come in to see me have started to look in the mirror and see early signs of aging, and they're just not yet ready to go under the knife. And so those are the ideal patients for this. A patient that has more severe laxity might be better with might do better with a surgical facelift. But really the best way to determine if you're a good candidate is to come in and have a consultation with your doctor.
And what does this procedure cost to do a full face and neck lift?
Well, some of my patients that come in only have one area of concern. So for example, we can just treat the neck, or we can do actually a full face treatment. So treatments start at about $1,500 and go up from there, but it's actually still much more economical than a surgical facelift.
Sure. So a full face neck would be like $4,000?
Anywhere from $3,000 to $4,000,
Okay.
depending on the area where you live and your individual physician.
So is this available all around the country or just in certain cities right now?
It's available all around the country right now. We were actually one of the first centers to receive the device, and we're very excited to offer our patients down in the Wall Street area this opportunity.
Fantastic. And tell us about the procedure itself. Does it hurt? Does the patient remain conscious throughout?
You know, it's great. There's really no downtime. Patients can return right to work immediately after the treatment. Basically, a treatment takes anywhere from 30 to 45 minutes for a full face. There's no anesthesia and there's no surgery. There's no cutting required at all. There's just some transient redness of the face that usually resolves by the time they leave the office.
Is there any discomfort?
There is some discomfort, and that varies from patient to patient, but usually it's very well tolerated. The discomfort occurs only with treatment, and it resolves immediately. So in general, my patients leave the office very happy.
Very, very happy. And
Yeah.
how long do they stay happy? How long do the effects last?
Well, that's really a good question. And we know it lasts for at least a year, and it may last longer than that. The 1-year time mark is because all the clinical trials that have been performed in the United States have lasted for a year.
Okay.
So we know it lasts that long, and it may last longer.
How is this different from other non-surgical age repairing treatments out there?
Actually, that's one of the most exciting things about it for me than other devices. Everything to date, lasers, radiofrequency, all the other treatment modalities have only focused on the skin. And we know that aging is not just skin deep. It occurs the full thickness of our facial tissues. With this technology, we're actually able to focus beneath the skin and target the SMAS layer that you pull when we as surgeons perform a surgical facelift. So we're actually treating the skin from the inside out.
Fantastic. Dr. White, thank you so much for all this information on this fascinating procedure. And for the latest health news, be sure to visit us on the health page at abcnews.com.